Good morning and welcome to Reopening Connecticut Arts Venues Science-Based Safety. I'm Eric Dillner, the CEO of Shoreline Arts Alliance and the chair of this task force. The mission of our task force is to offer you the opportunity to reopen your arts venue from a public health perspective, provide a listening and sharing platform, and to help build consumer confidence through science. Our goal is to offer you clarity, practical scientific advice, and an opportunity to ask questions related to your risk reduction strategies. We will help you dive deeper into your own process, lead you to building strategies for consumer confidence, and ensure success and long-term viability for you and, of course, the arts sector as a whole. Together, we can and will reopen and keep open arts venues with prudence and knowledge. Today, our webinars have reached over 10,000 viewers in over 15 states and 4 countries. We've been working with arts collective, playhouses, ballet companies, museums, schools, performing arts centers, you name it, to look through the lens of science and with this great team from the Yale School of Public Health. We encourage everyone to attend each of our webinars and follow Shoreline Arts Alliance's YouTube channel and our Facebook page for additional information. You may also find resources at www.shorelinearts.org. And we, of course, want you to share this information as broadly as you like with all of your colleagues. This information will help our country, will help our world open and be in a much better place with the arts. I'm so pleased to introduce you to my co-chair, Sten Vermoen. Sten is the Dean of the Yale School of Public Health, and he holds the Anna M.R. Lauder Chair in Public Health, as well as a secondary appointment in pediatrics in the Yale School of Medicine. As an infectious disease epidemiologist, Sten's research pivoted quickly to focus on COVID-19 emergency. Sten and his wife are deeply fond of cultural arts, and he is so pleased to offer his advice and counsel to arts and organizations, not only here in Connecticut, but throughout the country. Today, we also have Sten's colleague, Jason Schwartz. Jason is an assistant professor in the Department of Health Policy and Management at the Yale School of Public Health. His research examines how evidence informs the development of regulation and policy in medicine and public health, with a particular focus on vaccines and vaccination programs. His publications have appeared in the New England Journal of Medicine, the Journal of the American Medical Association, the American Journal of Public Health, and many other places. He is currently a member of Governor Lamont's COVID-19 Vaccine Advisory Group and a co-chair of its science subcommittee. Needless to say, we're in great hands as we embark on this extraordinary day in history with the rollout of vaccines. I'm sure if you popped open the TV at all today, you've seen it's all about this rollout of vaccines. So we couldn't have timed this webinar better. So let's get right into it. So Sten, today we're going to focus on vaccines and how they will positively affect the future of the arts. So Sten, would you mind framing our discussion today by perhaps giving us an update on the vaccine biology and development? Sten?
Yes, Eric, I'd like to do it briefly because I think Jason Schwartz has a lot to say to us.
Great.
Just a couple of quick things about Jason. He is representing the Yale University on the governor's task force for vaccine deployment. I know that's not its exact name, Jason, but you'll tell us in a moment. And that's a very suitable role for Jason because Jason is a historian of vaccine deployment in America, has studied and done policy analyses of many prior circumstances, whether it's the emergence of varicella vaccine, whether it's the emergence of the rotavirus vaccine, many of the big ticket questions and policy issues around new vaccines have been the source of Jason's research. So I think what he has to say will be of immense interest to this particular audience. So I think I don't want to be redundant to what the evening news has to say. We have a unique vaccine, a messenger RNA vaccine, which we believe to be very safe and joyfully very successful. You can't do much better than 90-95% efficacy estimates for vaccines. That's right up there with measles, which is one of our best vaccines. And so you have an extraordinary immune response. We're not sure how long it's going to last. Lots of questions still out there, but as a short-term tool, to help us return society to normal, we can't think of a better tool than this particular vaccine. And there are a number of vaccines to follow. And since they've all targeted an immune response to the spike protein of the virus, they all are probably going to work to one extent or another. So there's more optimism in the coronavirus vaccine arena than I can say for any other public health tool that's out there. And I think with Moderna and Pfizer, we will see others in their wake. And you may have heard about the Sanofi product. It wasn't very effective in the elderly. Well, we may be able to deploy that product in the young and preserve the RNA vaccines for the elderly. There are all sorts of strategic ways to use a vaccine that may not be as immunogenic in elderly people, but is pretty good in the young. So use that one for the young, you see what I mean? And then use other ones. So there are many, many ways to think about this as a tool. And safety issues loom large. The news there is overwhelmingly positive. There was one neurological disorder that was noted in the AstraZeneca product, and we're intensively researching whether that could be plausibly vaccine related or whether it's completely a coincidence. When you vaccinate 30,000 people in a clinical trial, and then you vaccinate another 30,000, another 30,000, when you're up there at well over 100,000 people in vaccine trials, you're going to have background disease rates that would have occurred without the vaccine. So to sort it out and to figure out whether it's plausibly linked to vaccines, that's our job, those of us who do vaccine sciences, and some of those questions are outstanding. But would I take a vaccine? I would take it in, I would hang up on all of you, and I would go in and get it now if that's what it took. Yes, I would. I would give it to my loved ones. I would recommend it to my friends, because this vaccine hesitancy is way past the science. It's much more in an emotional state rather than the objective risks of vaccines. The objective risks of licensed vaccines are exceedingly low. That's why they're licensed. That's why the FDA and the American Committee on Immunization Practice of the CDC has recommended that they be licensed because of thorough safety judgment. And like I said, we're not sure how long they're going to last. You know, do you need boosters every year, every 3 years? Those questions are unknown, but so far so good. It looks very promising. So I'd rather actually shut up. You've heard from me many hours on prior webinars on the public health challenges facing the arts. What I'm really keen is to hear from Jason.
Well, thank you, Sten. We don't want you to hang up though and go get that vaccine real quick.
No, I'm not on the short list. I'm not a practicing physician anymore, so I'll wait my turn with all the rest of you.
Well, that's good. At least if they start knocking on the door in a few minutes, just have them hold off for just a minute. Well, Jason, again, thank you so much. We are so thrilled that you're here to join us today, and we're hoping that you can help us, use history a little bit here to start the conversation, and think about how history can teach us, inform us, and guide us in strategizing our future. Because I really think if you could give us another little framing of this in the face of what may, in all of our minds, actually, if we're like Sten and ready to go, what do we do in the face of vaccine shortages? Can you talk to us a little bit about the framework of vaccine distribution?
Absolutely, Eric. Thank you, first of all, for the invitation. Sten, it's good to see you. Sten and I, because we've been working at home, we haven't seen each other in person since March, but it's always nice to see my colleagues here over the Zoom camera. That's our world these days. And let me just say to I know all the folks from the organizations participating today, how much we miss your presence in our lives and our communities here along the shoreline, and how eager all of us are to have you back at full speed again. I know what a challenging time this has been for everybody, but I know particularly for your communities, your industries, your passions. I should say we have a colleague, Sten and I, at the Yale School of Public Health, who has been up in his home in the Vermont mountains since June, since we're all working remotely. And he has said, this is the truth. He has said there's really no reason to come back to New Haven until A, I need to be back in the office, and B, the arts and culture communities of New Haven are back there to enrich his life. So I think we'll find that our this inflection point that we find ourselves in today with the vaccine program beginning, and I think the story of our time together today will be that this is not a light switch. This is not a momentary switch to things returning to normal. We can't think of it that way, as I know you all know, but the introduction, the addition of the vaccine to our toolkit in the response to COVID-19 signals that we are beginning a new chapter, and a chapter that will lead us closer to the destination we're all looking to get at. As Sten, to your question, we'll talk more about the work that the state's doing, I know, a little bit later, but in terms of context, as Sten noted, I trained initially in the history of medicine and science, and it still informs the way I think about the topics that I study in vaccine policy and politics and regulation and law and ethics these days. And I think it's worth noting that we find ourselves obviously in an unprecedented situation. There's so much that is new, obviously, about this world we've been living in. So much new about these particular vaccines and the technology underlying them. So much that's new about this vaccination program, which will really be unprecedented in the speed and scale and scope of it if we're going to pull it off successfully. So there's so much that's new here. And one of those metaphors that we often hear is that we're sort of building the airplane in mid-flight in terms of how this vaccination program and rollout will look in the weeks and months ahead. So I don't want to suggest that we have a playbook that will simply be rolling out in this situation, because far from it. However, we've got the benefit of years of well-established systems and mechanisms and experts and expertise and examples to draw upon in terms of how we have been developing, regulating, manufacturing, and now implementing this vaccination program that at least provide us some context, some lessons to draw upon, and has helped accelerate the fact that we've got these vaccines so quickly, that we've been able to turn to our time-tested systems and organizations and scientific community to help us innovate, even while still recognizing the context in which we're coming from. Vaccination is generally, we think about vaccination more often as a routine part of pediatric care and adult care, where we have very formal schedules that have been tested and studied and implemented over many, many years, and there's a structure and a cadence to it. This is a very different kind of program, but it's not the first time that we've had a mass vaccination effort in the United States where we have a new vaccine against a pressing health threat, and it's been an all-hands-on-deck scenario to figure out how to get the vaccines to as many people as quickly and as safely as possible. So I don't want to do a whole history mini lecture here, but I'll give you just a few examples, just in terms of context, in terms of where we can look to for analogs as we think about the weeks and months ahead. I think a few examples, one that some of you may remember, may have lived through, may have been children at the time, is the implementation of the Salk polio vaccine campaign in 1954, where again we had a threat, a viral threat that was a significant cause of public distress, public concern, public alarm, not nearly as prevalent a source of infections and deaths as COVID-19, but something that had captured the public imagination, and a vaccine development program through the Salk vaccine polio trial that was eagerly and carefully watched in the same way that this vaccination program has been. And in 1954, the rollout of the Salk polio vaccine led to a massive quick vaccination campaign. That one focused predominantly on children because of the trends of polio infection, produced by multiple manufacturers. It had bumps in the road. I think there's no doubt to signal that it was not a frictionless implementation. It turned out that one of the manufacturers of the Salk polio vaccine didn't quite inactivate, kill the polio virus that goes into the vaccine as well as they should have, and that's not a good thing, and led to a safety scare, led to some infections and deaths specific to the time, a very long time ago, a very different context, but vaccination moved on, and we saw just tremendous benefits in the decline of polio cases in the 1950s. So we have that example, far away, remote, different, but I think there are some insights we can gain from it. More recently in the present, or towards the present at least, influenza has often been our concern about novel influenza pandemics, the idea that we could have that 1918 flu level of public health emergency has been a concern for decades. And we had 2 examples of mass vaccination campaigns over the last 40 or 50 years. Again, ones that don't quite map on exactly to our current moment, but give us a sense of what might lie ahead. 1976 is an important example of that, where there was a cluster of cases of a novel influenza, swine flu as it's referred to, on a military installation in New Jersey earlier in the year of 1976. And that led to concern that this would be the kind of novel influenza that could spread and wreak havoc over the population. A novel influenza vaccine was urgently produced, manufactured, and recommended to the U.S. population, even though after that first cluster of cases, there were no more swine influenza cases found. So that vaccination program is often referred to as a quote unquote fiasco because of the fact that there were some lapses in terms of how the scientific decision making occurred, the decision to deploy the vaccine, how the vaccine was deployed. Were there some risks associated with it? I think lessons that have informed the rigor of our regulatory processes, the reasons that all of us, I echo Sten completely, have so much confidence in these vaccines that we're seeing right now, the way they're tested, the way they're being evaluated, the need for them. That example, I think, is a good sort of contrast, frankly, to what we're seeing right now. Last example, and then I'll let us pivot to the present. The closest example we have chronologically and otherwise was the H1N1 influenza epidemic in 2009, 2010, one that I think is probably closer in our memory banks. And that was, again, another novel influenza strain that prompted concerns that this could lead to a greater pandemic of the kind that we'd seen in the past with influenza. We developed in the summer of 2009 a novel influenza vaccine, since this strain hadn't been included at the time in the vaccine strains that we had used previously. A influenza vaccination campaign against H1N1 flu was launched in the fall of 2009. Again, fortunately, by the time we had that vaccine, it didn't take very long because we know how to make influenza vaccines. We know how to swap out one strain of flu for another. Even though it didn't take that long to get a vaccine, by the time we had it, the H1N1 influenza pandemic was waning. It wasn't nearly the threat that it could have been. So let's say we learned some of those reflexes and muscles for how we would work from a federal government to a state government to distribute a vaccine at large scale. But frankly, we didn't test the system as much as we'll be testing it now because of the fact that the threat had subsided, the demand wasn't nearly what we'll be looking at here. But it's given some lessons that our colleagues in state and local and federal public health are still drawing upon, of saying, how can we make sure this vaccination program goes as relatively friction-free as we would like it to be, that we can deliver vaccines safely, affordably, equitably to populations. And I think that has informed some of the work that we're living through right now in our current moment. So that's a lot of material. I think I'll stop there and throw it back to Eric to see where we'd like to go next.
Well, that's great. Thank you, Jason, so much. I mean, your knowledge in this field is so helpful for all of us to have a sense. Now, we're also so fortunate that you are sitting on the Connecticut governor's COVID-19 vaccine task force. And I probably don't need to spend a lot of time here, but I'd love to help all of us understand. We've read that the task force is there to communicate to the public, to help figure out distribution processes, to optimize where vaccines start. Can you just make sure that we're all on the same page with what your goal is there and how best you're advising the governor?
Sure, happy to do that. Yes, it's a privilege to support our efforts here in Connecticut to get these vaccines made available to our fellow citizens as best we can. I think colleagues of mine, this is a joyous day, as I mentioned, with the arrival of these vaccines, but we need to temper that with realism, as I've said, that as hard as it was and the scientific challenges that had to be overcome to get us vaccines as quickly as we have, it's a monumental achievement, historic achievement. The work ahead of getting these vaccination programs up and running and deployed and at the pace we need is every bit as difficult, every bit as challenging, every bit as significant a set of issues, albeit different ones than the scientific issues that we've proven with a lot of smart minds, a lot of investment, a lot of dollars, we've been able to overcome. So we have a new set of challenges, and this is an all hands on deck scenario between the federal government, state and local governments to figure out how to best use these vaccines, how to get them in the right hands, get them to the right groups, as we'll talk about, in ways that recognize that our supply will not meet the demand and interest for this vaccine, at least initially, and try to think about how to do that in the most scientifically sound, well-grounded, evidence-based, ethically cognizant set of ways. So here in Connecticut, because this is a federal state partnership in terms of how these vaccines get distributed, that the federal government is procuring the vaccines and then distributing them to states on the basis of their population, and then states have the lead in terms of what happens next in terms of where those vaccines go. There's guidance, there are recommendations, well-established recommendations from a variety of bodies. I'm sure we can talk more about those, including the Centers for Disease Control's expert advisors about where the priority groups might be. But ultimately, states are entrusted with the decisions about when they get a shipment of vaccines, literally where they go, not just in sort of an abstract population or risk group level, but what's the shipping address for these boxes that we see rolling off the assembly lines right now? And the states have been communicating their judgments to the federal government, and that will continue as production scales up. So to support that effort from our colleagues at the State Department of Public Health, who are literally working night and day. I mean, I was on a call at 9 o'clock last night with them as they're trying to make sure this program gets up and running the way that we all want it to. Those folks are working, heroically to try and figure out all of these details in real time, even as we learn more about the pace of vaccine deployment, the pace of manufacturing, the scientific issues that Sten noted. The governor's, the formal name, the governor's COVID-19 Vaccine Advisory Group, is here to support the state in all of the ways that we can provide insights, expertise, analysis to help them make these critical judgments, these critical operational decisions that they're facing in the months ahead. It's an interdisciplinary group of scientists, of policy experts, of community leaders, of clinicians, really trying a cross-section of the state that can help inform and help be a resource to the governor and to the Department of Public Health in any ways we can. And there's sort of three lanes, and then I'll just frame that, and then we can pivot to, I think, the one that's probably our focus for our time together. We recognize that there are a set of challenges with respect to getting these vaccines available. One are the scientific issues that Sten spoke to. We want to be, obviously, it's important that the public and the state has confidence in these vaccines, that we are vigilant, all of us, about making sure that we know as much as we need to about their vaccines, their performance, how they perform in different groups. Are there particular things to be attuned to? Are we vigilantly monitoring their safety? Have they been studied and developed in a rigorous, evidence-based way? With the integrity of those scientific review processes? That's one piece of the puzzle. That's the one that as Sten mentioned, I'm serving as a co-chair of that group that fits into this broader organization, but we're all working on all of these issues. The other, one of the others, has to do with communications and education, an important point that Sten's signaled as well, making sure that the public has the information they need to know about these vaccines, why they're important, why they're valuable, how they've been studied, why we're confident as scientific and medical professionals about their value, and responding to those concerns and fears that we know are not specific to this vaccine. Some are, but some are just broader anxieties about vaccinations in general that have had circulation for many, many years, as Sten indicated. And then the third subcommittee, and we all, we divide up the work, and then the full advisory group hears from these groups and then deliberates, has to do with the issues around allocation. That very important question about, okay, when these 31,000 doses come into Connecticut today, where are they headed? And when the next 31,000 and the 60,000 after that, how does that rollout look like in very granular determinations? And we've got good guidance from many groups, the national academies, the Centers for Disease Control, other organizations that have developed these tiers, these priority groups that you're hearing about on the news this week, starting with those healthcare providers, next week expanding to residents in long-term care facilities. And then going forward, the groups will expand. So the allocation colleagues of ours are taking the first look at those federal recommendations and guidance. They're saying, how well does this fit the Connecticut story? Are there particular questions about our communities, our mix of professionals, our mix of occupations, something that might say we want to tailor those federal recommendations in a Connecticut specific way. They bring them to our full advisory groups, which meets monthly. There's a meeting, the next meeting is this coming Thursday at 6 o'clock. It's on CTN, it's streaming, it's open. Transparency is a really important part of the process. And in an iterative way, we'll be making recommendations, which is all we do as an advisory group, is make recommendations to the Department of Public Health, to the governor, who ultimately has the decision-making authority. So that's the structure. Again, another long answer, an important question, but that's where our work fits into this broad, very broad and very challenging vaccination campaign that we're just beginning.
Well, that's fantastic, Jason. So just let's keep going with that train of thought. The distribution supply chain of these vaccines. I mean, as the arts community is looking at this, we can't help but think about our businesses and our livelihoods, our individual artists, and how might we make a case for getting up on that chain a little bit higher. And we totally get it that there's a difficult choices all the way along in this, optimizing who's going to get it when. And I really appreciate that you said that we're talking about Connecticut in many ways today, but we're really all states clearly have to make their own decisions. But it sounds like we have a long ways to go in making some decisions about who and when we will get those. So we might tag team a little bit here. I'll just kind of throw the mic to you and Sten together to talk about with the role of the arts in wellness and mental health of our state's citizenry and our country's citizenry. Is this something that we should talk about a little bit more as a possibility of getting up a little higher on that food chain?
Yeah, I'll start with a process observation or two, and then Sten, I'd love to hear your thoughts on the issue as well. Right, so process-wise, let's think, we can think in terms of sort of 3 or 4 buckets. Right now, the first bucket, the first wave of vaccination is that healthcare provider, medical first responders, long-term care facility residents and staff. And that was, I think, fairly non-controversial in all of the different groups, that the urgency, the severity of the pandemic, the risk, the groups that are most affected, that population, about 24 million Americans nationwide, I don't have the Connecticut specific numbers off the top of my head right now, was the group that should absolutely be at the front of the line. Later, this vaccine, there has been very little testing in children for a whole host of reasons. At some point, obviously, these vaccines will be studied in children. And if we're going to think in terms of that herd immunity concept you've heard about, children will need to be vaccinated. But that's well into 2021. Before then, we'll be healthier, younger individuals who are not essential workers. I think, fortunately, that's a bucket that I think I would fit into. That's probably looking at the summer. Somewhere around the summer. And then in between, there's this critical point, this next phase after where we are right now, before we get to those healthier, younger individuals and children's, there's that phase 1B is what it's referred to in our bureaucratic jargon. And that's this very complicated, challenging set of considerations around essential workers, other frontline workers, individuals with high-risk medical conditions, older Americans, the list goes on and on here, teachers, K through 12 teachers. That is where there's going to be, in the coming weeks, this is, we're not right there at the point, but it's not far away, that wave of vaccine recipients in starting, let's call it February, March, April, how we tease out those groups, which is a huge swath of the population. If you think about those various categories, that's where there is a tremendous amount of discussion, debate, and saying, how do we think within that big bundle of populations? And on our call last night, one of our colleagues noted that the co-chair of the allocation subcommittee, the person who's beginning to sort of lead these efforts, is probably the most popular person in the state of Connecticut right now, because all sorts of groups are saying, well, let's think about where we fit into this standing, and absolutely, I think as we think about how we think about health outcomes, how we think about our health and well-being of our communities, this is a conversation to be having at this time to help hear the kinds of perspectives and how we can make these impossible considerations about impossible but necessary considerations about how to do that tiering. I'll be quiet and let Sten jump in a second, I promise. The one point to make that I think is reassuring is that even as we think about this sort of ladder or whatever we want to think about it, funnel of the vaccination program widening. We're fortunate that because of the vaccine production capacity that we're hearing about, because of that rich pipeline of additional vaccines that are looking promising, we're not talking about a vaccination program that's going to extend over many, many years until we have sufficient supply. We're talking about, a few months as the programs scale up and we move from one phase to another. So we're fortunate. Every day, every week, every month matters. I know to our health, to our communities, to your businesses. But we're thinking about a finite period where there's going to be limited supply and tough decisions to be made. And I think, your groups should be part of that conversation. So I'd love to hear what Sten has to say on that in particular.
The arts are part of the solution. We need the arts for our wellness. We need our arts for our happiness quotient. The creative and innovative part of our society depends upon the arts. And I want to commend those of you who have managed to creatively keep the flame alive, which includes practically everybody on this call. Those of you who run museums have reopened safely. Performance venues, many of you have managed outdoor activities, online activities, even activities within your venues, within the governor's guidelines. How you're able to do it with the fiscal constraints, I just have no idea. And I know that some of you are in extremis. Many of the groups are in extremis. And we want to thank all of our donors and boards for keeping us afloat this time. And we hope everybody can stay until the post-vaccine time when normality is restored. Having said that, I think one advantage having Jason on the call is to make a pitch to you, Jason, to think about performing artists as a very unique subgroup. And should they get it before nursing home patients? Of course not. But should they get it near the time that teachers are going to get it? I would argue that if we can keep our performers safe, I think we can keep our audiences safe. I've done a dozen site visits at various venues around the state, and many of you have come along on those visits, and we have plans for audiences to be physically distanced, to have optimized hand hygiene, optimized lobby and bathroom and entry and exit strategies, to have universal mask use. The tricky wicket is, how do you keep the performers safe and ensure that the audience knows that the performers are not going to infect them and are not going to infect each other? And that is complex. And I would argue that's a small group of people. It's, comparatively speaking, we have fewer performers than we do audience members, right? So if we can keep the audience members, can we save, can the performers be kept safe through vaccination? It's just tough to do drama, music, singing, dance, if the performers are not protected. So that's my pitch to you, Jason. Now that you're in a policy-making role, I'd love to see whether you can just have in the back of your mind as these discussions unfold, performers in the performing arts field. Now I forgot the question you asked me. I don't
think we should go back to the question. I think we should hear what Jason has to say now that you've put him on the spot here.
Well, I was sort of all riled up on that point, and
I think that's great. Let's stay right there.
Okay,
Jason.
Sure. No, I'll say, as I also see, I don't want to jump into the comments and questions, but I see them popping up here and they connect to things that Sten is saying. I think also we recognize how important, when the categories, our artists are such an important part of our, not just our arts and culture and our lives that my colleagues will do on a night out in the town, but they're so important also as we think about education, as we think about the venues and the settings in which the the important roles of getting schools open and trying to address these really, challenging issues we faced with education, especially here in New Haven over the course of the year, is to recognize the role that the arts and artists and trips to art institutions and museums and concerts and shows and are an important part of also the broader fabric of our community, and particularly as we think about young people. My 7-year-old takes piano lessons after school at his school here in New Haven, and it's a professional musician who comes in at the end of the day to do these lessons for dozens of kids every day after school for weeks. Well, how do we think about that? How do we think about that group? Is not a full-time licensed teacher at the school, but absolutely is doing an important service in an educational setting. And as we think about where those groups would fit in, or the kinds of organizations that come in and do activities as the eclectic set of activities that all of you I know do in different settings and different venues, the challenge is the questions get really hard, really hard, and the math gets really complicated very quickly to then start of thinking about not just even how to structure those decisions, but ultimately then how to implement it, how to identify the populations who fit those categories. It's been hard enough, I've seen in the last couple of weeks, to figure out, healthcare professionals. Healthcare professionals obviously are doctors and nurses and other groups, but then the swap, what the denominator is of who actually constitutes a healthcare professional, and all of those folks that make our healthcare systems work, has proven to be a really difficult challenge. So it's helping to try and think about, all right, well, what's the group? What are the contours of the group? And then how does that fit with the pace at which we get vaccines, knowing that we have projections, where projections are hopeful, projections are just that. There's I think an important conversation to be had, an important case to be made. Obviously, I mean, I'm one voice of many, and I think all of us are eager to hear these perspectives and help those shape our views, and recognizing what Sten says, that I think we're trying to balance both a couple considerations. How do we prevent the maximum number of infections and deaths that the disease causes? How do we prioritize vaccination that way? How do we prioritize the way to minimize transmission, which sometimes means using the vaccine in a slightly different way? And then also, how do we use the vaccine in tandem with all of these other strategies and techniques and tools that we know can work if we're faithful and diligent about them, to build public confidence, a sense that the public feels safe, that can go back and engage in our communities, engage in our businesses, engage in the art scenes. And the vaccines serve an important role in that piece as well, above and beyond maybe the clinical things that we see of charts and cases. And I think Sten's last points to that the vaccines, the more we get it available to more groups, the more that folks will be comfortable engaging in the things that are important for our communities, are important for mental wellness. And I think that's the way to think about these really complicated trade-offs. So it's a dodge, I admit, Sten, slightly, but I think these are important issues to start sorting through and thinking through, all of us, as we hit these critical weeks.
But
I don't confuse you for the Commissioner of Public Health or the governor or anybody else, but you are an influential individual on this point, so I thought it wouldn't hurt for you to hear our arts point of view. I wanted to highlight something that I've thrown in the chat. Every arts organization on this phone, and if your friends were not on this phone call, please cut and paste this to them, need to go to the Department of Public Health vaccine enrollment website. This is a little known phenomenon that I want all of you to be aware of, and you should do it today, because this is what the state is trying to do to identify all of the employers to fix the problem of not knowing who the artists are. So if you can then claim, your organization is listed on this vaccine website, then when it's your time, you will be contacted. Otherwise, how will they know you exist, and how will they know that you have a certain constituency that needs vaccines? So I've put the website in there. Eric will find a way to put it on his website, and I would like you all to sign up. My son is a self-employed optometrist. He signed up yesterday. He's got a company of one, but all day long he's a 1.5 feet away from the face of all of his patients, and he'd like to be considered for vaccination. He doesn't want to get out of out of order with what is reasonably thought of. He doesn't want any special consideration, but he doesn't want to be overlooked either. And so I don't want any of you to be overlooked. So please go on that form. It'll take you 5 minutes to fill it out.
Well, that's really, really good information. Let's all take that to heart and wait another 20 minutes before you go hop on there and do it. But no, but we want to get y'all in there. So both of you touched on it, but I just want to make sure that we don't breeze by the mental health aspects of the arts and how important we've seen over the last few months. This need and desire right away in March, April, we saw, singers out in our balcony trying to spread, pull the gloom off of it and helping folks with their mental health. I mean, we can go on list of all the mental health aspects. And I think when we're sharing that information about the arts, this is a time when we're going to be in an age of health after we move from this pandemic for many, many years is where we're going to be thinking and how we can be healthy. So I don't know that you have anything more to add on that, but I just think it's very important, again, Jason, for us to be thinking about what the arts have always done and what they will continue to do, and maybe even be more important in days to come.
No, I hear you and agree. I mean, I think, so much of what has made this, so many things have made this pandemic hard. I don't want to even attempt to rank it, but it is that feeling of isolation. It's that loss of community. It's that loss of coming together in settings outside of our little Zoom squares here in so many ways. And the arts provide in so many ways those opportunities for folks to share insights, to share beauty, to share culture, to be engaged in our cities and towns, and that has such benefits, that aren't captured when we think about just the case rates and case definitions. So I hear you. And one other concrete point I'll mention as well to many groups and organizations, and I think you should join this conversation, is by all means, in addition to the registration that Sten notes, by all means, and I'll figure out exactly the contact route and share that with you, Eric. Our advisory group is getting letters from lots of professional organizations, from whether it's the funeral directors or the physical therapists. I'm trying to think of others there that are synthesizing their views about how their own community contributes in all the ways that different professional groups contribute to the health and well-being of our state and the perhaps the particular issues that its professionals face. And those formal letters absolutely get shared among the advisory group. They're publicly available and they're shared with us directly. So by all means, from this conversation, of the ways to synthesize the points that come out of this conversation, other points that you think are important for the advisory group to think about as they move these decisions, by all means, I think that would be another way to formalize that and make sure it's in the queue. So it isn't just me hearing them, but it'll be all my colleagues in writing as well, in addition to what, of course, I'll bring back in my contributions to that. So I'll circle back with you, Eric, to make sure where where your group, if you choose to do so, can make sure your voices are formalized in written form for the advisory.
Absolutely. That's what we so much want that. So thank you. If you can send that over to me, we'll get it out to everybody so we can start moving along that direction. So let's step into the world of, we are now getting the vaccines. We're a few months down the road here, and we now want to get our audiences back. And we've been talking about consumer confidence as a group. Really from day one, this is a challenge. So what type of things do you think we should consider as we're opening our venues or expanding the numbers in our venues? Should we be considering things like all of our staff are vaccinated, and so we then celebrate that as a reason, as a means of getting folks back in the door? Or should we log request information from people? Are you vaccinated? So that then we can say our audiences are filled with vaccinated people. How far do we think we should go with this? And what's your opinion on that?
Yeah, no, it's a great question. And it brings it to one really important scientific point that has fallen under the radar, but it's going to be really important as we think about how the vaccination adds to our response to COVID-19 and the benefits that we hope to see. And it's that as of now, we actually don't know the extent to which vaccination prevents the transmission the transmission of the virus, of the disease from one person to another. We know that vaccination, based on the clinical research that Stan has reported, is highly effective at preventing disease in the person who is vaccinated. But that's different than whether or not in those individuals who are not getting the disease now, whether they're still getting infected and whether they can still spread the virus to those around them. So that's going to be a really important message. We're going to learn that. That's being studied. There's confidence that in all likelihood, if folks aren't getting violently sick, they're probably not as likely to transmit asymptomatically or otherwise the virus or the disease to individuals once they're vaccinated. But we don't know that for sure yet. And that's why that has two implications as we think about your particular question. That's why we need to make loud and clear that the vaccination can't replace anytime soon all of the strategies and tools that the public health community is thinking about, that I know your businesses are thinking about, the masking, the limitations on distancing, all of the limitations on crowd, the distancing. We need to think about the vaccine as an additive to all those techniques, at least for the foreseeable future. In time, we'll be able to sort of dial back those so-called non-pharmaceutical interventions, is what they're often referred to in the trade. But we need some time to let the vaccine take hold. And then in the meantime, it's really getting the vaccine to as many people as possible as quickly as we can. So we can't, we have to be, somewhat guarded in terms of what we think the vaccine will bring in terms of the risks to others. We know the benefits to the individual. So that'll be an important point there, and recognizing that I think the value of the additional measures, at least through the winter and into the spring, as more people get vaccinated, we'll see those numbers come down, and I think we'll be more comfortable about it. I hope that helps a bit.
Absolutely, and this is not a one-sided call. Just so you know, we're not trying to just pin you to the wall here. We also want to offer an opportunity for you to know that this is a group that you can come to, your task force can come to ask questions. We have people in all the different arts avenues, educational avenues that we can hook you up with, so to speak, to help get some real clarification on what may be a question that came in that you don't quite have a clear understanding, because it's just a vast community that we've built together here, which is great. I'm thrilled to say that we are to hear you say that we are going to make sure that STEN's Big Five, I don't know if you've heard STEN's Big Five, but that those will continue on. But I think what we could do as an arts community is continue to help with your messaging, if you're interested in that help. We all need to be thinking about how we can help our communities continue to do the right thing, so to speak. And if you all have messages that you want us to help push out there, please do so. My organization, Shoreline Arts Alliance, just did a call for artists for them to express themselves. What have they been doing in this time, and what are they doing? And what's fascinating is you can start to see some mass conversations and some conversations, about washing your hands and those kinds of things. So, again, a little bit of a plea here to say, don't make this a one and done here, and you've heard from us. We want to hear from you and help in any way.
No, that's fascinating, and thank you. And absolutely, I think one of the ways in which the state is thinking about this work, the vaccine work, and the vaccine in the context of this broader response, as we enter what we know will be a hard few months. I mean, I think no one, wants to suggest otherwise in terms of what the next, few months might look like while the vaccine is starting, but it's not going to yield the benefits that we need, and we find ourselves in a tricky spot, at least for the immediate future. But going forward, I think one of the important points is the idea that to build the kind of support and confidence in the vaccination program, to build the continued resilience for those other public health strategies and messaging, STEN's Big Five, can't just be the domain of folks with MDs and PhDs trying to get those messages out there. That's important. That's critically, a critical central cog of helping communicate the kinds of strategies that can get us out to the other end of this story. But I think the state recognizes loud and clear that we need partnerships with all sorts of our communities, from our religious communities to our business communities, and I would suggest the arts community as well, to be partners in engaging and helping get those messages out about the importance of the importance of the vaccine, the importance of adherence and continued confidence in those other strategies, and to recognize that voices that meet people where they are, that resonate with groups that are important to them, that they value, that they share, that they share affiliations with, are every bit as important, or at least additionally important to the kinds of things that come from folks with public health in their title or medical credentials. So I hear that out. That's another piece I'm glad to hear, and I think I'll take that back to the group and recognize that we've got partners. I mean, we're all trying to get to the same destination here as quickly as we're possible, and I think that's comforting. I know as we figure out so much uncertainty between now and then, to know that there is that solidarity among so many parts of our community and our society. So thank you for that offer as well.
Absolutely. Sten, I know you're busy answering questions like crazy as always, but I see that Frank Tavera from Waterbury, or Palace Theater in Waterbury, has a friend in Great Britain that has a question, has a thought. Frank, do you want to pipe in here for a minute and offer that question?
Sure. Can everyone hear me? We're good?
Yeah, you sound great.
Okay, great. Yeah, I mean, watching CBS this morning, yesterday, the West End has opened. Broadway, Les Mis, Phantom is all reopening. People are anxious and going. Eric, to your point, consumer confidence, I think people are just excited about being able to return to the theater. They have launched the vaccine prior to us. They are opening their West End or Broadway sooner than we are. What can we learn from them over the next couple months before we anticipate the eventual reopening of our theaters or New York and Broadway? So what are we going to learn from them? And what should we be looking out for from what happens in Great Britain?
Yeah, that's a great question. I lived in Britain for a year and learned a little bit about some of the differences. It's a lot easier to do a libel suit in Britain, but other than that, it's not as litigious a society as the US. And if you bought a ticket to West End Theater of your own volition and got COVID, you'd be unlikely to succeed in the British courts by claiming that you got COVID because of the irresponsibility of the West End producer or theater owner. You'd be unlikely to succeed. You'd be unlikely to even go to court for something like that. It would be thrown out in their preliminary. But in the US, you might make a lot of money suing, one of the Schubert organization because you went to this play and you're going to claim that you got infected in that play. If a jury says, we're on your side because we think Schubert's got a lot of money and you need some of it, then they'd be in trouble. So I'm going to guess that the attorneys that consult with Broadway are going to keep them closed longer than the barristers who consult with West End. So you've got it's a legal issue that is likely to be driving this, not a public health issue. I believe that Broadway could open, but it would open with a very small audience. You would have a physically distanced audience. And that simply may not be a viable business model for Broadway theater owners. They need to have X% of their seats filled every night to break even. And you know how often a Broadway show closes after, 5 nights. So it's tough to open if you can't fill your seats. So the costs of a Broadway show to mount it are vast. Now, none of that applies to all of you. You don't have the costs of a Broadway show, but you may have some of the same issues. If you can only fill a sixth of your theater or a tenth of your theater and keep people safe, can you actually pay for your costs of running that evening? And that's really a business and legal decision that you're going to have. I've been consulting with you on what the safety precautions would be to open safely. And Crystal Pollitt's on the phone if we have a last minute question on air quality for her, since now we're pivoting from outdoor activities to indoor during the winter. But that's where I think we are, Frank.
Thank you so much. So there's a question on the Q&A that I think it's probably a good one. Can you just clarify, do you think that anyone who wants a vaccine will be able to receive one by the end of 2021?
Yes,
Sure.
I do.
Yes.
I think so. I
An
think,
emphatic
yeah, no, I think end of 2021, we will find ourselves there. Now, you've heard even more optimistic forecasts from some of the folks associated with Operation Warp Speed about, maybe even pushing that number into early summer. But I think where we are now, that even just with these two highly efficacious vaccines, the one that's in the news today, the next one that very likely by next weekend will be rolled out, that the math, the supply, the production that we'll have enough vaccine doses available by the middle, I think third quarter is often what Dr. Fauci likes to say. So mid to late summer, where we'll have the supply, even maybe sooner if some of these other vaccines come through beforehand. We'll have the supply available. Now, again, that's the pause, that's the glass half full. The glass half empty view is, will we have all the systems in place to get those vaccines out of the vial, out of those ultra cold temperature freezers, and get it to the tens of millions, hundreds of millions of Americans to meet the demand? And will we have all those efforts in place to make sure the demand is there and that there aren't the kinds of fears and concerns that Sten alluded to that will hold down the folks lining up? That's another big part of the puzzle. So supply, I think, will be there well before the end of 2021. Logistics, implementation, demand, getting the vaccine into people's arms, because that's when it makes a difference. That will extend into the early fall. But I'm hopeful. I mean, I have had tickets to a concert in New York City that was actually originally scheduled for March of this year, was rescheduled to the summer. It was rescheduled to now November 2021 in Madison Square Garden. Will there be 18,000 people in Madison Square Garden in November 2021? I'm not sure. I don't know what Sten thinks about that. But that's, we're starting to find ourselves in that point, I think, by next fall. And certainly far more flexibility with respect to smaller events than that of the scale that you're all talking about. But before the end, by this time next year, yes, I think if anyone wants a vaccine, they will have had plenty of opportunities and plenty of time to get one, is my forecast.
I think the tricky part is kind of like a parent sending their child to a school where the school district does not enforce mandatory vaccination. You start getting very suspicious of your neighbor if they're not vaccinating their child, and your child then is theoretically at higher risk. And it gets even worse when your child can't be vaccinated because they have an immunosuppressive condition. Maybe they're battling cancer. So now you're sending your child who couldn't get a live attenuated vaccine to a school where other children may not be vaccinated. So I think that dynamic is going to play out in the arts. They're going to ask you, are the people sitting next to me vaccinated? I'm vaccinated, but I know the vaccine's not 100%. What about the people sitting next to me? So there may be arts guidelines where, let's say you run a dance studio, you're going to ask your students and your teachers to be vaccinated. Or let's say you're having an event, and to buy an online ticket, you tick mark that you've been vaccinated. And if they don't tick mark that, you say, we would prefer you to get vaccinated before joining our venue. I mean, these are legal questions, and maybe the next meeting we're going to have a lawyer join us, because I'm no lawyer. I can't give advice in this space. But these are issues around building consumer confidence. And on that note, I have to go to my next call.
I was going to say, Sten, you may not be watching the clock, but I know you, and you got something now.
I wonder if you could ask Crystal if she has. Does Crystal have 3 minutes on advice for indoor air quality as the winter comes? And I'll have to leave you at that point. Thank you.
All right. Well, I want to thank you again, Sten. We will see you soon. And Jason, again, I'm sure you have to run just as he does. We just can't thank you enough for your time. Science has been our guide, and you're just a testament to all that we believe in, which is making sure that we can deliver the goods in a safe and prudent way coming out of this, because we know it's a necessity. So again, thank you, Crystal, also for being on the call. I guess we didn't get you today, but we know how invaluable you are too. What a great team. We're just so fortunate. Jason, do you have anything you want to leave us on a high note?
No, I'll just say thank you all. Thank you. I hope this conversation continues. As I said, I'm happy to keep talking, Eric, with you and your colleagues and all of you. And we know how important this vaccination program is to everyone and your communities and businesses and in particular. And I think, all of us who are involved from the science to the manufacturing, to the development, to the regulation, to the policy, know how important it is to try and make this program go as well as it can. And hard work ahead. It's going to be bumpy. There's going to be hiccups. There's no doubt about it. But I think we recognize the urgency and the potential and hope that this vaccine gives us to know that we have this really powerful, valuable tool. And now let's put it to work. And I think that's where we find ourselves, in really this hopeful moment, despite a hard year for everyone. But we're things are looking up, I think, and hanging in there will really help us get us to where we're all hoping to be in 2021. And where in 2021 we'll see, but I think we can all contribute to that important effort. And I'm glad to have this chance to chat with all of you and hear your perspectives and make sure that they're heard and voiced and expressed, and continuing to be a resource to you, and grateful that you will be have made the same offer to us as well. So I've really enjoyed it.
Absolutely. Well, thank you so much. Our next event for all of you is scheduled for February 2nd. It's a Tuesday. Who knows? Sometimes we pop them in at the last minute also, add them here and there. But that's the next one that we have calendared. So I'm looking forward to seeing you all, and wishing everyone a happy holidays and a happy new year. Here we come. Thanks again, Jason. Take care, everyone. Yeah. Bye-bye.